Alright, so we're going to do a video of the heart and its relationship to the lung. So we'll start off with the diaphragm. Heart sits on top of the diaphragm. Diaphragm separates the abdominal pelvic cavity from the thoracic cavity. In the thoracic cavity, you have subcavities, right? The heart has its own space that's known as the pericardial cavity, and that's defined by those membranes that we spoke about, the pericardium, the visceral and parietal layers. The lung has its own cavity, right pleural cavity, left pleural cavity. And behind the heart, there is a space that's known as the mediastinum. And that's where you find your aorta, the trachea, your esophagus, in the space behind the heart. So the thoracic cavity is broken into subsections. On this heart, we're not going to do a lot of detail with this heart. We just want to talk about the relationship between the two sides. But you can see that at the base, oh, I shouldn't say base, at the bottom, okay, comes to a point that's known as the apex. And the reason I don't want to use the word base is because it's the top of the heart that's actually called the base. So the wide top is the base, the pointed bottom is the apex. It's counterintuitive, right? What else can you see? You see these tan structures. These are little extensions off of the atria, all right, off of the atria. These are known as auricles. So there is a right auricle extending off of the right atrium, and there's a left auricle extending off of the left atrium. It's really just an extension of that chamber so that there's a little extra space within the chamber. And below that, so in this general region would be your right ventricle, and over here in this general region would be your left ventricle. And you see that there is a little depression here in between the two. And that's referred to as a sulcus. That's really where the wall between the two chambers exists. Right? A little indentation. And there's one here, indentation, somewhat between the atria and the ventricle. And there's another one over here between the atria and the ventricle. These are called coronary sulcus or coronary sulci. Okay, little indentations. And notice that there are blood vessels typically running through there. The coronary circulation, the vessels that supply the heart, run through those sulci. Right? It's not really as nice as the others, but there's some yellowish coloring here to indicate that there is some fat surrounding the heart, adipose tissue, and you see it on some of the other models. Most organs have some adipose, some fat surrounding them. Okay? Now the vessels, which kind of show the relationship between the lungs and the heart. So we started our discussion here with the right atrium, meaning the right atrium is going to receive the oxygenated blood from the superior vena cava, the inferior vena cava, and something that you can only see on the back, the coronary sinus. Coronary sinus is picking the oxygenated blood from the heart tissue. Inferior vena cava is picking up from all parts of the body below the diaphragm. Superior vena cava is picking up from arms, neck, head, above the heart. All the oxygenated blood goes there. Then we know it moves here to the right ventricle through the valve. Right ventricle contracts, and here it goes, moving through this large vessel. This is the pulmonary trunk, and the pulmonary trunk is going to split and go into the left lung and into the right lung. You can see a little bit of the right pulmonary artery here, and you can see a lot of the left pulmonary artery and its branches going here into the lung. That's carrying deoxygenated blood away. It's an artery, but it's painted blue, and that's the exception. Here in the lung, pick up oxygen, blue turns to red. Now it's oxygenated, and now all of these vessels pick up the oxygenated blood, and they're going to return it back to the heart. Return to the left atrium. So the pulmonary veins go back to the left atrium. The pulmonary veins, and you can see a little bit of it here, go back to the left atrium. And if you turn it over, you can see your left pulmonary veins and your right pulmonary veins, and they're bringing blood back to the left atrium. And from the left atrium through the valve to the left ventricle. Left ventricle, thick muscle, strong contraction, pushes it up into the aorta. And the aorta has some components or parts to it, meaning the first bit is called the ascending, and then it's going to curve, right? And the curve is going into the model, so it's curving into the model. That's the arch, and then it's going to start heading downward. And as it heads downward, that becomes the descending aorta, or sometimes called thoracic aorta, until it gets to this point. When it pops out of the diaphragm, it becomes the abdominal aorta. So there is a relationship between the lungs and the heart for oxygenation purposes. Last set of vessels, right, up here. So here's the superior vena cava. It's bringing deoxygenated blood from all structures, arms, neck, head. And you see some contributory vessels here. Right? In the venous system, it's symmetrical, meaning what you see here is the same as what you see here. Less this little guy in the center. That's a inferior thyroid vein. Okay, leave that guy out for a minute. But this and this is the same naming of structures. The right and the left brachiocephalic veins feed into the superior vena cava. The right subclavian and the right internal jugular feed into the brachiocephalic. The left subclavian and the left internal jugular feed into the subclavian. So it's symmetrical and blood returns. All right? The problem with this model is that in the world of the jugular veins, there's two. There's a big fat internal jugular, and there's supposed to be a small little external jugular next to it. The only model that has it right is here. Big fat internal jugular, internal jugular, and a smaller external jugular. That's how it should be, but obviously you see on this model they left one out. With regard to the red arterial system, not symmetrical. Right and left are not the same. Meaning, on the right side, okay, you can see, I'll turn it this way, there's two vessels here feeding into this common vessel. And this is the right subclavian artery. This is the right common carotid artery. They feed into, from here to here, this little short segment, the brachiocephalic trunk. There's only one brachiocephalic trunk, and it's only on the right side. On this side, yes, you do have a left subclavian artery, and you do have a left common carotid, but they do not feed into a brachiocephalic. The subclavian goes directly to the arch of the aorta. The common carotid goes directly to the arch of the aorta. Have the brown heart. Those squeaks are going to sound really nice on the recording. See here? There's the arch. There's your brachiocephalic on the right. There's your common carotid and your subclavian on the left. There is no brachiocephalic on the left.